What is just as interesting is the other types of targeting CD19 CAR T cell therapy. So there are several other different products. One is a slightly different affinity within SCFE, so the low affinity SCFE with the targeting same antigen CD19 CAR T cell therapy, so which has preliminary data in a pediatric kind of the European data showing a lower rate of a severe CRS, which is quite interesting. So if it happens to be proven to be true, that may actually suggest a safer option for our adult ALL patients targeting the same antigen with a different affinity. So that's kind of the one interesting data that we are waiting to see. The other one is allogeneic, the product as well, the off-the-shelf. So that there are some challenges of getting these adult ALL patients with aggressive disease, getting them to autologous CAR T cell product or generating the T cells from the patients. So allogeneic with off-the-shelf donor T cell derived CD19 CAR T cell therapy, preliminary data has been presented in the past before, and there are several ongoing international studies looking at the efficacy in the larger patient population. So we also await the data for those the products as well. And then there are still ongoing, the less updated in the past ASH, however, the 1922, so bispecific, the CAR T cells targeting CD19 and CD22 at the same time. So again, with the hope of reducing the rate of a 19 negative relapse by targeting two antigens simultaneously. So again, we also await the final results of the data. So it's a lot of ongoing clinical the studies for testing the efficacy of a CAR T cell therapy with the ultimate goal of bringing safer and effective CAR T cell for adult ALL or any ALL patients, but particularly adult ALL patients where there's critical unmet need.